If we knew nothing about psychology and were asked to describe what a crazy person is like, most of us may describe the behaviors of someone with schizophrenia. These quote-unquote crazy people, however, are still people who live amongst us, and they don't all experience schizophrenia the same way. Some of the most common symptoms and behaviors displayed are both auditory and visual hallucinations, speech distortion, bizarre delusions, ritualistic behaviors, and ultimately, the inability to interpret an internal reality from an external reality. So today, I want to take you a step closer into this illness and tell you about the treatments that have been developed from a historical point of view. And for the sake of keeping this video from being too overgeneralized, I'll focus on the general treatments that have been developed in the US. However, if you'd like to know more about the treatment developments in other parts of the world or during different time periods, make sure to comment down below so we can see your suggestions and develop more videos in the future. So, without further ado, let's get on with the video. It has been generally accepted that schizophrenia has been present since the very beginning of humankind. However, direct treatments that were meant to address the symptoms and behaviors weren't truly implemented until the early 20th century. According to an article published by the Journal of Affective Disorders in 2001, one of the first effective treatments practiced on schizophrenic patients was ECT, also known as electroconvulsive therapy, which is a process where short electrical currents are transmitted to the brain while a patient is under anesthesia. The first successful ECT was practiced in 1934 when Ladislas Meduna, a neuropsychiatrist, was able to stimulate the brain of a 30-year-old man who had been severely affected by his worsened schizophrenia. Ever since, this form of treatment has been highly practiced in mental health institutions, both in the US and globally. The resulting behaviors of patients demonstrated and indicated that ECT was generally most effective for mental illnesses such as depression and bipolar disorder. Although there are no clear indications that ECT is harmful to patients, it has been highly criticized for negative effects that it places on long-term memory and the high psychotic relapse rates that it encourages amongst patients. During the early 1950s, the launch of pharmacotherapeutics, also known as drug therapy, caused a breakthrough in the treatment developments of schizophrenia. The reason why this was such a big deal was because drug therapy developed antipsychotic medications, which were one of the first forms of treatment that didn't involve direct brain intervention from practitioners. According to an article published by the Journal of Neuropsychopharmacology in 2008, some of the most common medications are dopamine D2 antagonism and chlorpromazine, which are directly involved in changing the dopamine levels that are in the brain. This can be effective in terms of controlling psychotic symptoms of an individual. Ever since this breakthrough, there have been over 50 additional antipsychotic medications that have been developed, all which cater to stabilizing dopamine levels. Despite the largely debated success of these medications, it has raised ethical problems amongst mental health practitioners in the United States, as the first generation of antipsychotic medications were also responsible for harmful, debilitating side effects of the human body. Given that schizophrenia is a very biologically based illness, it is also one that is deeply rooted in social relationships. Due to this realization, there was a greater push for community-based care as a form of treatment during the 1960s. This meant that instead of having people monitored or incarcerated in secluded areas for prolonged periods of time, there was more of a humanistic approach for addressing this illness, such as developing group therapy and more face-to-face interactions between people with schizophrenia and society. However, this form of treatment did not prevail in mental health hospitals, given that several of these places were severely mismanaged or underfunded. Due to the deinstitutionalization of mental health hospitals during the late 1960s, due to the lack of funds and support from the public, this left countless people with schizophrenia on the streets, with less mental health institutions being able to house and supply options for those with schizophrenia. A greater number of these people became more susceptible to substance abuse during the 1970s and 1980s. And since these were the decades in which President Nixon and Reagan enforced the war on drugs for the majority of their administration, this enforced a system of mass incarceration of hundreds of thousands of people with mental illnesses, especially those with severely developed schizophrenia. As we know, the conditions in prisons and jails, such as solitary confinement and limited access to antipsychotic medications, are not ones that encourage rehabilitation amongst these individuals. Despite all these developments in treatment and the outcomes that resulted, there is still no definitive cure for schizophrenia. Although psychotic medications have been proven to lessen the intensity of symptoms, they do not offer long-term improvement for these illnesses alone. Electroconvulsive therapy, although effective in treating the cognitive processes of those who may be diagnosed with both schizophrenia and manic depression, is not catered or effective for every individual with symptoms of schizophrenia alone. Hopefully now you can begin to understand that despite how far we've come in understanding this illness, both from the biological and psychological perspective, there is still so much more that needs to be done for these individuals. We hope you were able to find this video informative, especially on an illness as stigmatized as schizophrenia. If you're interested in knowing more about the histories of these illnesses in our society, make sure to subscribe to our channel and hit that bell icon to get notifications every time we post a new video. Also, don't forget to check out our social media handles, such as our Facebook and Twitter page for more information and insight on these illnesses. Thank you so much for watching, and we hope to see you guys on our next video.